Hi. So continuing with my discussion on digital health and becoming an e-patient. You've now learned how to make your own chart. You have tracked your own information. Now you need to go to the doctor, the digital doctor. Who are you going to see? Well, I think you're probably going to go to that big clinic we all visit called Dr. Google. Because Dr. Google is where everyone begins their medical search today. Now, Dr. Google is going to take you to a lot of different places. And there are plenty of people who think you should stay away from Dr. Google, that Dr. Google is a quack, and maybe Dr. Google is not reliable. I'm here to tell you that Dr. Google is reliable and more reliable than you think. So after you enter diabetes into that Google search window, where is it going to take you? Well, I would say in our digital practice, it might take you to some of the senior partners. It might take you to mayoclinic.com, it might take you to WebMD, or you might go to my favorite place for patients to start, PubMed Health, the U.S. National Library of Medicine, and you can just Google PubMed Health, and they cover all diseases, and it's all verified, high-quality medical information written for patients. But maybe you've already heard enough from the senior partners and you're looking to talk to someone a little more quirky. Maybe someone who knows a little bit more, has a little more focus in what you think the problem is. So those partners, I would say, are either journals or societies, such as the American Diabetes Association, the American Society of Clinical Oncology, the heart.org for heart attack, blood pressure, and stroke information, and all of the journals from The Lancet to the New England Journal, the Journal of the AMA, to more esoteric journals about maybe one disease or one organ. What's the glue that holds these senior partners and these junior, more esoteric sources together? Well, digitally speaking in our clinic, you know what I'm going to say, don't you? It's Wikipedia. What do we do with Wikipedia? This is a publicly created, publicly edited encyclopedia of information. And can I really trust it when I type in breast cancer or stroke or ovarian failure? How do I know this is reliable? Well, I don't want to get into a great discussion of Wikipedia, but I would first tell you at Wikipedia, always go to the bottom first. Look at the references and look at the resources. You could certainly Google how to use Wikipedia as a separate topic. But since we're going to talk about Wikipedia, here's what I've pointed out. I talked to my staff here in the office and I asked them, can you trust Wikipedia for health? And there was some debate, but I think I pointed out to everyone that it actually works out fine. That if you want to look up diabetes, Wikipedia is a great starting point. Or for heart attack, or for specific cancers. And then my staff thought, well, what about if it's something very rare? And so I threw out a couple of unusual items, and sure enough, we went through them anecdotally, but they have great references, and they take you to societies and groups that are focused on these rare diseases. So I think that Wikipedia is actually an excellent starting point for any kind of healthcare journey. Now, my last point is very important. These resources are useful for people with a proven diagnosis. So if you've been told by a doctor that you have X, Y, or Z, you can teach yourself a tremendous amount of information by going to those websites. You can reduce what we call the asymmetry of information, where in the old days only the doctor had the information and the patient didn't. You can even this out, which I think is incredibly important for your own health and to make the best use of time in the doctor's office. On the other hand, if you're just looking for symptoms, using a symptom checker and trying to find out what your diagnosis is, then we have to have a different discussion. And that's what we're going to do in our next video. Thanks so much.